At what stage do you start considering some more advanced interventions? We hear about the pacemaker for the brain. Mindy, tell us about that.
That's a great question. Deep brain stimulation is what you're referring to. So deep brain stimulation is ultimately good for some patients if you're the right candidate. What it does is actually it's FDA approved for improving slowness, stiffness, and rest tremor. And so ultimately, if you have a patient that is the right candidate that may be living by their pills, ultimately taking it too regularly, and that's all they do is think about their medications, or if they have side effects to their medications and they can't really tolerate it, for instance, nausea sometimes can occur with dopamine replacement therapy, or their blood pressure is going down too low, which is called orthostatic hypotension, or they're ultimately dyskinetic, like we talked about Michael J. Fox, where he moves a little bit more and it's uncomfortable for him. Sometimes you can actually decrease your medication by half or even more with deep brain stimulation therapy. And so that's the tipping point, really.
This sounds pretty scary, deep brain stimulation. How invasive is that, and what are the risks of putting an electrode in your brain and having a pacemaker in your chest to provide the stimulation?
So we talk about the risk and benefits of deep brain stimulation. It is a surgery. It is a lead that's placed in the brain. You do need to go under anesthesia, and ultimately they place a lead actually in the brain and tunnel the lead underneath your skin to a pacemaker that ultimately paces your brain. It's pretty amazing and marvel, actually, but ultimately we have to make sure the patient is comfortable with the possibility. The risks are low in regard to the possibilities of complications of the surgery itself, but ultimately we want to make sure the patient's ready for this procedure. And so we do a thorough evaluation. We talk to them. We make sure we know what their goals are. The nice thing about it with this wonderful center that we're in is that we have opportunities to ultimately work together as a team to make sure that's the right approach for this patient. So ultimately we have wonderful once a month discussions in regard to if this patient is the right candidate for deep brain stimulation. Again, it comes down to the patient's decision as well. And so we're a team all together to make that decision.
I also read that it's not just for Parkinson's patients, but patients who have a tremor without Parkinson's. So maybe I'll ask Selena, what's the difference between someone who has just a tremor and someone who has Parkinson's? Because we think of Katharine Hepburn, again, I'm dating myself, but the famous actress who clearly had a tremor in almost all of her later movies with her repetitive head nodding. Did she have Parkinson's?
She did not. She actually had essential tremor.
Essential tremor.
Mm-hmm. And essential tremor actually, Parkinson's is a whole body disorder that affects everything internal and external that is part of our body. Essential tremor is simply a tremor. It does ultimately affect balance as well, but it doesn't affect blood pressure, heart rate, everything else. Predominantly, it is just tremor. It is not a dopamine-based problem. It's more of a just electricity-based issue inside the brain.
So Mindy, you probably see a lot of folks who have a movement disorder that isn't Parkinson's, essential tremor being one example. Tell us about some of the other conditions that you see in the Salisbury program.
Yeah, so we're
because it's not just Parkinson's, it's Parkinson's and movement disorders that we address in that program.
Yeah, so mobility, movement. You have to think of all the aspects of what can be possibly abnormal in someone, whether it be walking instability, some people that have an internal tremor or internal restlessness, which is restless leg syndrome. I see patients that have just a change in their mouth movements, which can be tardive dyskinesia from medication-induced.
Tardive dyskinesia, unwrap that for me.
Tardive dyskinesia, tardive meaning medication-induced movements from a lot of times psychiatric drugs that you need for mood disorders. And so sometimes they need that medication, but it can create an abnormal movement of the face or the mouth. So Parkinsonism and Parkinson plus diseases, which again, not everybody that has a tremor and stiffness and slowness has Parkinson's disease. So we kind of have to understand the umbrella term of Parkinsonism. Parkinsonism, you have to think about, which I always explain to my patients, because a lot of times Parkinson's disease is not what they have. They may have that diagnosis for a long time and medication's not helping them. And so they come to us to evaluate, hey, what's going on? Why is it that the medication that I'm now on, many pills, and it hasn't done anything for me? Why is that happening? And a lot of times they have a Parkinsonism. It means that they look like they have Parkinson's. They have the cardinal symptoms of Parkinson's. However, they may have a Parkinson's plus disease, which again, we can go into if you'd like.